Hello everyone, I'm Dr. Shabahat. I'm one of the cardiologists in Pakistan. I'm working as assistant professor of cardiology in Pakistan, as well as will work as a cardiologist in Ireland, as well as been engaged in teaching of senior medical students in Limerick University of Ireland. So today I'll be discussing a very important topic with you guys, and it always has many questions in relation to that, as well as we will discuss all the questions about that condition, and that condition is atrial fibrillation, which we in simple language will say that irregular heartbeat. Okay, so I'll discuss what that in detail, that what is atrial fibrillation, why time is important in that, what would be the management plan and what can be the management plan, as well as why we offer and why we should adopt for anticoagulation if someone is diagnosed with atrial fibrillation. Okay, before going into that, I'll ask you guys, if you like my videos and like my channel, kindly subscribe it, like it, as well as you can also like my Facebook page with similar name, and you can find various videos and many videos regarding various medical conditions. And my purpose of making these videos is to educate community in simple language, rather than just speaking in bookish terminology, and just try to make things simple for them to understand, because and I would like to discuss their questions which they come up when we are going to treat them in our daily life. Okay, so let's go to the topic. So, what is atrial fibrillation? Atrial fibrillation is very common. I would say that around 25 to 30%, 25 to 30% patients coming in hospital are with this condition. While you are working in Western countries and in other countries as well, because this is not only having one source from heart, it can also be derived from other sources as well. Like atrial fibrillation in simple language is like irregular heartbeat. So if you start to feel any palpitation while doing work or anything, or if you are going through any infection or any other medical condition, and you have started to feel palpitation or racing of your heart, you should consult your GP or doctor straight away, because the basic things which we need in this to confirm it is ECG. If sometimes person is coming that I have one episode like for few minutes and it has gone, never came back, it's fine. Obviously, we cannot catch it, and then we can organize any holter in our OPDs and to catch it if episodes are frequent. But if you have found that episode is persistent, not going away, as well as you have felt any chest pain, chest discomfort, any shortness of breath, or increase in body weight and all that within a day or two. Even most importantly, I would say, like if you have started to develop palpitation and it's not going, and you are feeling it, and you have started to feel pressure even, or even not, but you are feeling the palpitation which is there for several hours, so you should consult to your doctor straight away for ECG, or you can go to ED or emergency straight away to nearest emergency, because atrial fibrillation is one of the condition, but there can be another cardiac arrhythmias as well. Okay, so we need to catch that. But if it's irregular heart rate, so it will be atrial fibrillation. So why time is important in that? because time is important. If you are coming within 48 hours of these symptoms, we might try to revert it back into your regular heartbeat, which we call it as sinus rhythm. Okay, so there are different management plan according to time as well as conditions. Sometimes a patient is inpatient, but that is easily catchable. If a person is inpatient with any active infection or due to any renal disease or any other thing, and person started to develop, we can easily put them on telemetry and we can catch it, or we can do ECG study. But if you are an inpatient, even you, if you don't have any previous heart condition, you should come to ED, and if it's diagnosed within time limit, uh, and if you don't have any other problems or anything, we might try to revert it back to sinus if everything else is fine. There are different ways like chemical cardioversion or electric cardioversion. But if you are coming a bit late, above 48 hours, we might not adopt cardioversion straight away. Okay, then in those scenarios, what would be management plan? If so, if you are coming after 48 hours, obviously we will control your rate. If it's above 100 or 110 per minute, we will try to control it so that your symptoms or discomfort of your chest due to racing of your heart can be improved. Okay, and other things we can plan for according to your age and other factors. But if you are less than 75 of age, in European country, I would say even less than 80 years, and if it's good 80s, we can plan for cardioversion. And it depends upon your other factors as well. First of all, if you came late after 48 hours, obviously we need to rule out any thrombus, because if we will cardiovert, there is possibility that that thrombus can go through your blood vessel and can cause any stroke. So before that, ideally, we should do echocardiogram first of all in your workup, which is transthoracic echocardiogram, to look for any obvious thrombus and your heart functions. And then accordingly we can plan either inpatient cardioversion or outpatient cardioversion, because if your symptoms are totally fine, you are asymptomatic, your heart function is totally fine, which is called as ejection fraction in your echocardiogram, we can plan for outpatient cardioversion, that we might ask you to come after 3 to 4 weeks of taking anticoagulation, not skipping a single dose, and then we can do cardioversion as outpatient. But if your pumping ability is decreased, which we have found in thoracic one, we can plan for inpatient cardioversion, which can only be done ideally after transesophageal, and because we need to look into other parts which are not visible in transthoracic echocardiogram, in transesophageal echocardiogram, so that any thrombus present in heart can be ruled out, and then we can do electrocardioversion. Then we can try to or attempt you to revert you back into sinus rhythm, so that your pumping ability might come back into normal, which was reduced if it was only reduced with that arrhythmia or atrial fibrillation. Okay, so that's why time is very important in that. So in many patients you have seen that doctor will tell you that you should take anticoagulation, okay, pixaban and other medications as well. So what could be those scenarios? First of all, if we have planned outpatient cardioversion, we will give you anticoagulation for a particular duration, and it will be stopped after if everything will be reverted back, and everything will be fine after reviewing you as our outpatient, or after a few weeks. Okay, but if your Chadwick score, which is a parameter of predicting any stroke probability in any patient is high, like 2 or above 2, then we will ask you to take anticoagulation for your whole life. Why? If you don't have any other contraindication or any other complication or anything else, like we will advise you, because the main purpose is to, like even if we have reverted back your rhythm into sinus rhythm, we will again, because that has been converted by ourselves, but because it was not converted by automatically. Okay, so in those scenarios, Chadwick score, why Chadwick, there is a various parameters, I'll discuss that in a separate video, but in Chadwick score we will see various parameters: your age, diabetes, hypertension, your other cardiac conditions, or anything else, heart failure things. So if you have these things, so your Chadwick score will be high. If you don't have anything, so your Chadwick score will be low, so you won't be needing lifelong anticoagulation. But if it's high, you should take this if no other contraindication present, because it will prevent the major complication caused by irregular heartbeat, which can come at any time again, if even if it has been reverted back due to manual cardioversion or automatically, uh, which is stroke. Because that stroke morbidity and mortality is also having a major risk. So in those patients who are having a high Chadwick score, we will offer them anticoagulation. Okay, so I hope I had made things quite simpler and try to address many questions with you, and kindly like my video, and if you have any question you can ask me in inbox or Facebook page, as well as comment in a comment section. I'll try to address it. If you like to make any video on any other medical problem, if you have any questions in terms of that, I'll try to address that as well in future. So I hope so. Things will be quite clear now in terms of atrial fibrillation in your mind. Okay, take care. Bye bye.